Hi, I'm Dr. Ash. I'm going to show you one of the many benefits of the Sae Arc for chiropractic patients. For most patients, what I like to do starting out, depending on what the area is, I either put this for their neck or this for their low back or mid back. What happens is you provide stretching and it provides circulation, so it loosens up the patient, and after you do this, your adjustments go a lot quicker. The patients feel almost instant relief after even about 30 seconds to a minute. There are many other stretches and different types of things you could do with these. If you have patients with postural imbalances, like tight pecs, anterior head carriage, things as simple as this, where you have them just put it behind the back and get that stretch in before you give the adjustments, helps a lot. And once they get that stretching, the pain relieves substantially. Same goes with the low back. You have them lay on this, and there's a lot of videos on YouTube and on the website that you can check out that you could have the patient do about 30 seconds to a minute, loosens them up. I have a lot of patients that even during the stretches, the adjustments go, so it saves you a lot of work. And those patients where you do your treatments and they're not fully recovered, or there's some lingering pain going on, you have them lay on this at the end, and you see most of it subside. So with my patients, I like to put this here, and you tell them to slowly lay back. And that alone is a great stretch. You're putting extension into the low back, it's stretching out the ligaments and tendons, loosening up the muscles, because we're always bent forward all day, so it really helps with pretty much every patient. And then what you could have them do, you could have them with both hands out, and you can even help them out by pulling and adding some traction into it. Really loosens up their low back, makes your adjustments go very easy. You tell them to hold that. And then you could have them come back. This is another stretch. You tell them to put their hands to their sides. I'm going to have you bend both of your knees. And you can just have them go side to side, back and forth. A lot of them feel adjustments just doing the stretch on their own. It's putting motion into your low back, loosening it up. It's amazing feeling afterwards. Another thing you could do is you just have them keep their foot straight and hold it. That puts pressure in their low back, but it's hitting against the wood where it's making you release the tension in your low back. And you can just have them switch off. So you could do that leg, bend it again, and you could do this leg, hold it, come back. Some patients actually like to do it this way, where they bend their knee up. So you could try it out with them, see what they like best. Works really well. Okay, 1, 2, 3. So now we're going to go for the cervical, which is very similar to the low back. There's different levels for different patients depending on how much curvature you want to put in and how much stretching you want to do. I like to start with just this one off. So you lay it down, have the patient lay over it. You want to put it in the middle of their neck. And right away they're getting stretching, the ligaments and the tendons are all loosening up, so for your adjustment it'll go a lot easier. I like to have the patient turn to your right. Just by doing that, you're exposing the muscle belly and it's putting pressure, so if there's any trigger points, knots, just tension, it gets relief. And you could do the other side. You could hold it, or they could even just do it back and forth, but you don't want to do it too fast because it might cause dizziness, but they love it. And then after you do this, you take it out, your adjustment goes like butter. Okay, so you could also use this for the low back instead of this one. This one is for more specific areas. I like to use the smaller one for the low back area. This is for the ones where you know the specific area where they have tension and they're stuck in flexion. So let's say it's over here. You just have them slowly come back, roll over it slowly. And already they're getting extension into where they're stuck in flexion. It's loosening up their muscles, providing circulation. So when you're ready to do that adjustment, it goes very easily. I also like to have the patients bend their knees, so it exposes the belly more and puts more pressure on the trigger point or whatever the issue is. You can even have them do a little bit of stretching while they're on that. And you can do it on both sides. And depending on the area that you have it, you could even do side to side. So now if you want to adjust the hips, the low back, or the mid back, it goes a lot easier. It's full circulation, and the patients feel a lot more comfortable when you're ready to do the adjustment.
Show how to use.
Yeah, this product is really useful for people who go to the gym. You can take it to the gym with you and stretch out. I have a lot of people with postural imbalances where everyone's like this. So it's very simple. You just have their patient put their hand behind their back, and it does it on their own. It provides stretching the pecs. It makes your rounded shoulders come back. You see from the side, it's very, very beneficial. And the second you take it off, the patient's already loose and comfortable enough so you can get the thoracics to go, the cervical to go. This is a really good stretching tool to do before or after any of your adjustments.